hoped I wouldn't have to make this video, but here we are. Today is Thursday, February 13th, and RFK Jr. has just officially been confirmed as Head of Health and Human Services.
Something is wrong, and that's why immediately after Bobby is sworn in, I will be signing an executive order establishing the President's Commission to make America healthy again. We have some great people on that commission. Chaired by our new secretary, this groundbreaking commission will be charged with investigating what is causing the decades-long increase in chronic illness, reporting its findings, and delivering an action plan to the American people. And it's going to be a plan that people are really waiting to hear.
Kennedy has routinely misinterpreted medical research studies on podcasts and interviews and made millions of dollars from his work with vaccine-hesitant media groups. Kennedy often says that he's open-minded and willing to change his stance if presented with evidence on topics like vaccines and autism. That sounds good on the surface, but the problem is that evidence is already freely available and astonishingly convincing that there's no link between vaccines and autism in study after study after study. That's just one example, but that means there's two options here. Number one, maybe he's not very experienced at critically reviewing medical evidence, which could be no problem if he's complemented in his role by a supporting team of medical and research professionals. Or number two, it could be that he's intentionally continuing to advance science-hesitant narratives under the guise of being open to changing his mind, which would be more deeply concerning. In every interview and podcast with Kennedy that I've listened to or watched, he references science the way that a lawyer would, picking out pieces of published data to build a compelling story, but not considering the broader body of evidence which may contradict that story. Kennedy has found popularity in wanting to make America healthy again and reduce chronic disease, increase access to healthy foods, and decrease the influence of things like sugary beverages and the food industry. And those types of high-level goals, I think, are basically universally agreed upon. The part I'm skeptical about is his ability to define specific evidence-based programs or actions that will meaningfully and measurably address chronic disease. It's one thing to say you want to help people be healthy, and it's another thing to achieve that in a measurable way. Those initiatives will be more challenging than usual amidst a backdrop of slashing research funding and budgets at departments Kennedy will oversee like the CDC, the FDA, and the NIH. I'm open to changing my mind on Kennedy if he proposes programs that will improve public health and medical research, in which case I will wholeheartedly endorse those ideas. However, if he misrepresents research to advance an agenda against the best interests of healthcare or medical research, I will not hold back in commenting on that either.